Bismillahirrahmanirrahim. Today we will talk about the palate. The palate is a structure which intervenes between the nasal cavity and the oral cavity. Look at that. This is the palate. It forms the floor of the nasal cavity and it forms the roof of the oral cavity. So the palate has two parts. The anterior two-third, which has a bony framework, we call this hard palate. This is hard palate, anterior two-third, and posterior one-third, which is soft in consistency. So this is known as soft palate. Now we will talk about the hard palate. Hard palate is formed by the two bony framework. One is formed by the maxilla bone and another one is the palatine bone. So look at that. In front it is formed by the maxilla bone and posteriorly it is formed by the palatine bone. Let's see another picture so it will be more clear. So we are seeing this view of hard palate from inferiorly. So look at that. This is hard palate. It is formed by the palatine process of the maxilla bone in front and horizontal plate of palatine bones posteriorly. Now what is the lining of the hard palate? We already told you hard palate is a junction between the nasal cavity and the oral cavity. So the upper surface of the hard palate, it will be the lining of the nasal cavity, that is the ciliated columnar epithelium, and the lower surface that forms the roof of the oral cavity, the lining will be the keratinized stratified squamous epithelium. Now what is the level of the hard palate? The hard palate, it actually lies in the newborn and infant between the base of the skull and first cervical vertebra, that is atlas, and in case of adult it lies at the level of the cervical two vertebra, that is known as axis. Now come to the soft palate. The soft palate is actually a fibromusculoglandular organ. Its anterior one-third is fibrous part, and medial one-third is muscular part, and posterior one-third is glandular part. And the movement of the soft palate, it helps us in speech and during deglutition. Now what are the parts of the soft palate? Soft palate, it is quadrilateral in outline and it has two surfaces and four borders. It has anterior surfaces, posterior surfaces, and four border. One is upper border, two lateral border, and one lower border. Now come to the anterior surface. Anterior surface is concave and it is projected downward and forward. Posterior surface is convex and directed backward and upward, and it forms the boundary of the pharyngeal isthmus. The upper border, it actually is connected with the posterior part of the hard palate, and two lateral border, it is continuous with the wall of the pharynx. Behind the nasal cavity, this is nasopharynx. Pharynx starts, so this is nasopharynx, and behind the oral cavity, this is oropharynx. So these two lateral border forms the boundary of the nasopharynx and osopharynx. And last of all, the lower border of the soft palate, it has a downward conical projection which is known as uvula. So the lower border of the soft palate is free and presents a medial conical projection which is known as uvula. Now the uvula, from the base of the uvula, two mucosal folds extend downwards on each side and forms two arches, that is palatoglossal arch and palatopharyngeal arch. Let's see another picture to see the palatoglossal and palatopharyngeal. So look at that. In this picture, the lower border of the soft palate, it presents a downward conical projection that is known as uvula. And from the uvula, two mucous folds extends downwards on each side. One is known as palatoglossal arch and another one is known as palatopharyngeal arch. You can see there is a lymphoid organ that is known as palatine tonsil. So in front of the tonsil, the arch is known as palatoglossal arch, and behind the palatine tonsil, the arch is known as palatopharyngeal arch. So palatoglossal, that means the arch will, glossus means tongue and palate stands for the soft palate. So it is the arch or mucous fold extending from the soft palate up to the tongue. So this is palatoglossal arch. Then palatopharyngeal arch, that means it will connect the soft palate with the wall of the pharynx. So behind the lingual tonsil, you can see another fold that extending from the soft palate up to the wall of the pharynx, that is known as palatopharyngeal arch. So in front of the tonsillar fossa you will find the palatoglossal arch, and behind the tonsillar fossa or tonsil you will find the palatopharyngeal arch. Here is another picture of the soft palate showing the palatoglossal arch, which lies in front of the tonsil, and behind the tonsil there is another arch that is known as palatopharyngeal arch. Now we will talk about the composition of the palate. The palate, it is composed of, the soft palate is composed of. Now the composition of the soft palate. Soft palate is composed of palatine aponeurosis, number 1. Then you will find some palatine muscles. There are 5 palatine muscles. Then you will find some nerves and vessels. Then you will find palatine glands, and sometimes upper end of the palatine tonsil. Now the lining epithelium of the soft palate. Soft palate, it is lined by the non-keratinized stratified squamous epithelium, except the upper part of the posterior surface, as it is closely lying to the floor of the nasal cavity. Here the lining will be the ciliated columnar epithelium. So the lining is the lining of the soft palate. It is the non-keratinized stratified squamous epithelium, except the upper part of the posterior surface, as it lies close to the floor of the nasal cavity. The lining will be the same as the nasal cavity, that is the ciliated columnar epithelium. Now at first come to the palatine aponeurosis. What is it? Palatine aponeurosis is actually a fibrous structure where all the palatal muscles are attached, and actually this palatine aponeurosis is the expanded tendon of the tensor veli palatini muscle. Now come to the palatine muscles. What are the 5 palatine muscles? The 5 palatine muscles are the levator veli palatini, tensor veli palatini, musculus uvuli, palatopharyngeus, and palatoglossus. And all these 5 muscles origin insertion is not so much important, but all you have to know the functions of this muscle. So at first, if we talk about the first palatine muscle, that is the levator veli palatini muscle. This muscle actually levator, that means it will elevate the palate. So levator veli palatini, its action is this muscle elevate the soft palate and close the pharyngeal isthmus. Second muscle, that is the tensor veli palatini. So it will tense the palate, that means it will stretch the palate. So the function is that it stretches and depresses the anterior part of the soft palate, and as well as closes the pharyngeal isthmus, and as well as it dilates the auditory tube through which we can hear. So hence its another name is the dilator tubi. The number 3 muscle is the musculus uvuli. So from the name you can have an idea, it will act on the uvula. So its function is it pulls the uvula forward to its own side. Number 4, there is palatopharyngeus muscle. Palatopharyngeus muscles, that means it will act on the pharynx as well as the palate. So its function is to elevate the larynx as well as the pharynx. It elevates the larynx and pharynx. It closes the pharyngeal isthmus by opposing the palatopharyngeal arches. And the last muscle, that is a palatoglossus. Glossus means tongue. So its function will be on the tongue. So its action is the palatoglossus, it elevates the base of the tongue and closes the oropharyngeal isthmus. Now let's have a look over the picture of these palatine muscles. Now this is a picture of the muscles of the palate, soft palate. You can see the tensor veli palatini muscle. This is the tensor veli palatini. This is levator veli palatini muscle. Then this is palatoglossal muscle. Sorry, palatopharyngeus muscle attached to the pharynx, and palatoglossus muscle, which is attached to the tongue. And one muscle, that is a musculus uvuli, which is not shown here. Showing the muscles of the soft palate. So you can see the 5 muscles here: the levator veli palatini, tensor veli palatini, palatopharyngeus muscle, palatoglossus muscles, and the musculus uvuli muscle. So you have to remember the name of the 5 muscles of the short palate. Now come to the nerves and vessels. What is the nerve supply of the short palate? The nerve supply of the palate, all the muscles of the soft palate are supplied by the cranial part of the accessory nerve. It is supplied by the all the muscles of the short palate. It is supplied by the cranial part of the accessory nerve, except a muscle, that is the tensor veli palatini. Except a muscle, that is the tensor veli palatini. This is supplied by the trunk of the mandibular nerve. It is supplied by the trunk of the mandibular nerve. So we are talking about their motor supply. So all the muscles of the short palate are be supplied by the cranial part of the accessory nerve, except the tensor veli palatini muscle, which is supplied by the trunk of the mandibular nerve. This is the motor supply of the palate. Now come to the sensory supply. Sensory supply is again divided into general sense and special sense. General sense means the sense of the pain, touch, temperature, and special sense means some special sensation. That is the special sensation that carries by the palate, that is the taste. Now the sensory supply of the palate. The sensory supply, that is the general sensation, that is pain, touch, temperature. This kind of sensation will be carried out by greater and lesser palatine nerves. Greater and lesser palatine nerves, as well as the long sphenopalatine and glossopharyngeal nerves. But the special sensations, it will be supplied by the glossopharyngeal nerve, mainly by the glossopharyngeal nerve and partly by the lesser palatine nerves. Now come to the artery supply. Artery supply of the palate. The palate, it is supplied by the greater palatine branch of the maxillary artery. The palate is supplied by the mainly maxillary artery. Number 2, it will be supplied by the facial artery. It will be supplied by the ascending pharyngeal artery. So the greater palatine branch of the maxillary artery, ascending palatine branch of the facial artery, and palatine branch of the ascending pharyngeal artery. These 3 arteries actually supplies the palate. And the venous drainage, all the veins drain into the pharyngeal venous plexuses. So that's all about the palate.